Hello guys, how are you doing? Welcome back to my YouTube channel. How have you been? So last week I recorded three videos. Somebody help me cry. They all did not have sound. So now it's 3 a.m. and I'm recording this video and I'm like, yeah, I'm working overnight though. So how have you been, guys? How is 2021 taking you? I hope you're well. Thank you all for watching my video last week, and we are here again to watch a brand new video. Today I want us to talk about living with HIV in the times of COVID-19, in terms of treatment, care, and support. Why I decided to do this video was because a lot of us a lot of people living with HIV in these times that we are also facing COVID-19 as a pandemic, we have actually experienced a lot of challenges in terms of access to treatment, in terms of psychosocial support, in terms of support even from our caregivers, and even access to healthcare facilities. And it has been more of a roller coaster for people living with HIV like me. First things first, let's start with the issue of treatment. Early 2020, now I'm talking about the Kenyan situation. We faced a lockdown where there was, though they called it a cute name, they called it cessation of movement. So people were not able to move from points. A few counties were locked, and you were not able to go to a different county if you were already in that county. And people actually missed their ARVs. I remember one case that was highlighted that somebody had traveled to Kilifi and they were living in Eldoret. And then they had only taken, I think, medication for 7 days. And the medication was, I think by the time she was reaching out, she was only left with 2 pills. So people were not able to access medication, and she was not the only one. There was also a case where the lady schools in Nairobi, lives in Kisumu, but because schools had been closed and she had gone back home and Nairobi was inaccessible, she was not able to access her medication. Because now she was asking me, what do I do? How do I go about getting my medication? So access to treatment became a little bit tricky. But then now we have something that actually was implemented. It had been there, but now it was the implementation started during COVID-19. It's called Differentiated Service Delivery, DSD, which is a method of delivery for treatment or ARVs to people in their homes or in specified healthcare facilities, where maybe like a private clinic, or now they actually, there's a name they're calling it now, where they want to bring it to pharmacies. That is still being discussed, so we shall talk about that another day. But then DSD was supposed to give peer educators and community health volunteers medication. They bring it to you, because if you are in a lockdown situation or you cannot go to the hospital for one reason or another, instead of stopping taking your medication, then they bring the medication where you are, which is a very good idea and a very, very nice initiative. But then some people living with HIV had reservations with that form of treatment delivery, because then there is the issue of disclosure, accidental disclosure, whereby a community health volunteer comes to your home compound. You're probably in a rural area, and they get you your medication, and people are like, okay, so what is that medication about? What is it for? A lot of people preferred though, to go to the nearest healthcare facility, whereby differentiated service delivery also includes you can go to the nearest healthcare facility, you can get your ARVs there. It doesn't have to be your own healthcare facility. And if you're a 6 months patient where you're given your medication for 6 months, or you're a 3 months patient, you're given the full dose, instead of how it used to be, where when you go to a new facility that is not your facility, only given medication for just 1 month. Because I remember during post-election violence, it happened to us. And because my facility was inaccessible, I went to the nearest healthcare facility, and we were given medication for 1 month. But that was it. You cannot go back there the second month. The second month, they tell you, maybe you are defaulting from your clinic, and we don't know, so you have to go back there. But then with DSD, it's now, things are turning different. So another issue was the issue of stigma. Stigma is actually the issue of stigma. Stigma not only for people living with HIV themselves from society, but also for among us, like for a person. They are taking medication, they are at home, they don't know what to do. Especially, I never liked the stay home, stay safe thing, because home was not really a safe space. And we have seen the effects of staying home and staying safe, because now we have a teenage pregnancy crisis on our hands because of the staying home and staying safe thing. We have new HIV infections because of that. And we have people who have stopped taking their medication because home was not a safe place for them. You know, the sad part about African setups or Kenyan setups is, at some point you are sharing. Not even at some point, we are always sharing spaces amongst ourselves. And so when we are sharing spaces, somebody keeps seeing you taking this particular medication every 9 p.m. They're going to get suspicious. They're going to start taking I saw a couple of photos on various Facebook groups, people posting and saying, what is this medication for? I have numerous inboxes on my Facebook page, people just telling me, so I got my cousin, she's taking this medication and it looks exactly like the medication you always post. And honestly, it feels so bad, because then you cannot even be safe in your own house, in your own space. And it's just, you know, very, very sad that people need to know that you're living with HIV, or why are you taking this medication? What is it for? And you know, you don't owe anybody, you are telling anybody your HIV status. You don't owe it to anybody, but for some reason, people feel like you should actually disclose to them, which is so wrong in very many levels, but it is life. And some other people who are especially discordant couples ended up finding that their partner has been on ARVs for the longest time ever, and they're not telling them. And most of them were devastated and in my inbox and asking me, what am I supposed to do with this? It happened. So living with HIV in the times of COVID-19 brought about a different perspective of HIV that we thought we were done with. We thought we were done with people who keep medication, people who how to access medication in hospitals, the issue of disclosure, but we're not done with all of that. In fact, it like reawakened it. Is that an English name? It's like it's reawakened it for us to see that this is actually happening. People missed food. I remember helping out some few people, and you could see the situation. And sometimes people would ask me a question and tell me, Doreen, help me, I am in need. One situation would be bad than the other one. The other one will tell you, I've not even taken my food for the last 3 days. I am even unable to take medication because I can't take medication without ARVs. So the issue of care and treatment and nutrition and staying undetectable or virally suppressed, we have actually, I feel like COVID-19 has brought about us as people, like the gains for us people living with HIV that we have actually gained so far have really gone back. I feel like those gains have been compromised. I don't know if it is just me, but I feel like the gains we had made before COVID-19, they have honestly been compromised, and maybe we will regain, definitely, because we are resilient. As people living with HIV and as a community, we are very resilient, and I know that we will regain, definitely. But it's going to be to show us that, can we just learn to love each other and love ourselves and encourage each other? Because now we had 2 pandemics on our hands. HIV that has been here for the longest time ever, that we have adapted, and COVID-19, which is a new pandemic which we had never known about, never heard of, and it was here with us and living here with us and giving us a very difficult time. And it is still here with us. So as you go out there, and also the issue of prevention, I had forgotten the issue of prevention. You find people have actually been exposed more to HIV during these COVID-19 times than before COVID-19. And now when people get exposed to, because some people even ended up moving in with each other, and then you find your boyfriend has been on ARVs and you know nothing about it, and now you're panicking because you just found the ARVs at home, and maybe you had moved in together because of the pandemic and you are quarantining together, and it's been a roller coaster. Some people were unable to access PrEP and PEP medication. Some people found out too late. And so, I don't like telling people, you now have to wait for 3 months and then you can go and get tested. I hate saying those words to people because I don't know what is going to happen to them in those 3 months that I'm telling them to wait. And in those 3 months, they will have Googled signs and symptoms. They will have gone through a lot of things, and they will have even concluded that they're HIV positive, even if they're not, or if they are, they will have already, maybe some people get into depression, others get anxiety, all because they were exposed at some point and they were unable to access medication or even any form of prevention for one reason or another. So one of the things that COVID brought out, especially to the people living in the HIV community, is you must learn to be resilient at all times. You must accept your HIV status. It doesn't matter how you got infected. Learn to accept your HIV status, because most of the time we have not accepted our HIV status, and that is why we find it so hard to adapt, to live with other people amongst us, and then they start seeing us as the enemy when we are not the enemy of anything. So can we learn to love each other, to be kind to each other, to also ensure that we are open-minded, because as time is going, also treatment and even delivery of treatment is going to be different. We have come from a time where we used to be given medication for just 1 month, some people 2 weeks. Now we have 3 months, we have 6 months. Probably we will go to a year for the very, very stable patient. So can we learn to be very open-minded that these are things, Uganda is actually doing it, and it's doing so well, especially when it comes to DSD. So can Kenya be a little bit more open? And if you're watching this person living with HIV, let us try to be more open about differentiated service delivery. Let us try to be more open about our HIV status. Let us try to be more loving and accepting of ourselves. And then let us also try to prevent our loved ones and also protect ourselves. Okay? So thank you so much for watching this video to the very, very end. And if you reached here, I urge you to subscribe, like, and share. And see you next week with a brand new video. Bye-bye.